Cancer. Its rate of outbreak is high in developed countries, and it's a disease that kills 1 in 3 people in Japan. The 5-year survival rate of patients with terminal cancer is extremely low. That is the reality faced by Japan. However, cancer treatment is on the verge of undergoing a revolution overseas. In 1985, evidence presented to the U.S. Congress triggered major changes in the treatment of cancer in the U.S. The following statement was issued by the director of the National Cancer Institute in the U.S., David Sidransky, a world authority in cancer research. It has recently become clear that cancer cannot be treated by anti-cancer drugs. This has also been proven to be theoretically correct at a molecular biochemical level. Administering anti-cancer drugs simply prompts cancer cells to develop genetic resistance to the drugs, rendering them ineffective. This is the same as the way noxious insects develop resistance to pesticides. Moreover, anti-cancer drugs also attack the hematopoietic system, which produces lymphocytes, so its administration creates an environment for the proliferation of cancer cells. This prompted numerous initiatives to find new treatments in the U.S. The mortality rate from cancer plummeted thanks to development and understanding of alternative therapies in diametric opposition to trends in Japan. In 1988, it was reported in the National Cancer Institute's major report, Public Presentations, Research Publications, and Public Service Announcements, that anti-cancer drugs are not only ineffective, but they are powerful carcinogens. They are nothing more than carcinogens that create new cancers. Moreover, it says radiation therapy depletes immune cells and points out that its fatality rate is higher than that of anti-cancer drugs. This report was relayed around the world, but it was barely reported in Japan. As cancer treatments around the world shifted to alternative therapies, boosting the survival rate, why is it that Japan continues cancer treatments with low survival rates that are said to be 50 years behind? Furthermore, why is it that many doctors in Japan do not rely on anti-cancer drugs or radiation therapy when members of their own families develop cancer? What is cancer anyway? Professor Abo of the School of Medicine at Niigata University says, treating cancer is not difficult once you understand the mechanism behind it. Thousands to tens of thousands of cancer cells created inside our bodies every day are destroyed by our immune cells. When some of these cells survive and start to multiply, that's when you develop cancer. So, why do cancer cells multiply? The cause is stress. There are many types of stresses, and they are generally divided into 4 types. One is biological stress from viruses, bacteria, and so on. Another is physical stress from UV light, electromagnetic waves, radiation, and so forth. There is also chemical stress from pesticides, food additives, drugs, environmental hormones, etc. Then there is mental stress from interpersonal relationships, work, social acclimation, anxiety, or fear. These 4 factors are collectively known as stress. Stress leads to dysfunction in the autonomic nervous system. The autonomic nervous system is independent of the brain, and it controls the involuntary effectors of the human body. It is the autonomic nervous system which controls the movement of the heart, the blood pressure, the secretion of gastric acid for digestion, and so on, to involuntarily maintain the appropriate internal environment. The autonomic nervous system has a sympathetic nervous system and parasympathetic nervous system, which function in reciprocity. Exercise, work, and so on increase the activity of the sympathetic nervous system. The parasympathetic nervous system increases activity while relaxed. Increasing the activity of the sympathetic nervous system leads to an increased amount of adrenaline and noradrenaline released. Adrenaline is the hormone that triggers the fight or flight response, while noradrenaline is known as the fear hormone. Increased granulocytes in this state generate active oxygen, destroying bacteria. A large amount of active oxygen destroys healthy cells, causing inflammation. When this inflammation occurs inside the stomach, it causes stomach ulcers, or if it occurs in the duodenum, it causes duodenal ulcers. This is the reason why stress leads to stomach aches and diarrhea. Moreover, the increase in granulocytes decreases the number of lymphocytes. The number of granulocytes is inversely proportional to the number of lymphocytes. So when granulocytes increase, lymphocytes decrease. Conversely, when lymphocytes increase, granulocytes decrease. In other words, when granulocytes increase due to stress, it increases the amount of active oxygen, leading to decreased lymphocytes. That's what creates an internal environment conducive to cancer cell multiplication. So, what are the cancer treatments available today? When a person is diagnosed with cancer, the three main treatments that are almost always recommended are extirpation, chemotherapy, and radiation therapy. So what are these three main treatments? Let's look at them in greater detail. The first treatment that is considered is extirpation. This removes as much of the cancer as possible. But there are many specialists who question this method of physically removing cancer cells. Dr. Fukuda, who is the author of famous books on immunotherapy in Japan, and who is an expert on digestive organs, with over 30 years' experience in removing stomach tumors. Surgery damages blood vessels and tissue and deprives the body of its natural healing powers. He bases his views on his own experience in extirpation spanning 30 years. He says his success rate did not improve over 30 years. The survival rate, especially among patients with advanced cancer, was less than 10%. Lung cancer, which in 100% of cases in Japan would lead to extirpation, only results in surgery 5% of the time in Canada, a country with advanced medical care. Yet the 5-year survival rate in Canada is higher than in Japan. Many experts have pointed out that the reasons for this are deeply rooted in the medical practices and system of Japan. Moreover, Japanese medical department textbooks continue to teach complete removal as being the standard procedure. It is also viewed as a problem by many experts that nothing is taught about the natural healing powers of human beings. Extirpation is then followed by chemotherapy. Prompted by the statement issued by Director Sidransky of the National Cancer Institute at the U.S. Congress, the OTA, a U.S. government research organization, launched investigative experiments. In 1990, the OTA acknowledged that alternative therapies were saving more terminal cancer patients based on a report that completely negated the efficacy of chemotherapy, and recommended the National Cancer Institute and the Congress that investigations be carried out and aid be offered to alternative therapies. Their conclusions were based on investigations into the progress of chemotherapy administered at 20 universities in the eastern U.S. The investigation targeted 743 subjects with stage 4 lung cancer. The patients were divided into 4 groups: and detailed records were kept on their recurrence rate, recurrence interval, survival rate, and so on. The results revealed the anti-tumor effects to be 20% in Group A, 13% in B, 6% in C, and 9% in D. Groups A and B were administered multiple anti-cancer drugs, and cancer cell removal was most effective in these groups. However, numerous subjects in Groups A and B died several weeks after administering the drugs. Side effects from anti-cancer drugs were 7 to 10 times heavier than in Groups C and D. The recurrence interval was shortest in Group A, being a mere 22.7 weeks, or 5.5 months. It was only 31.7 weeks, or 8 months, even in the longest Group C. In other words, the report proved that the survival time was shortest and recurrence rate was higher the more anti-cancer drugs were administered more often. The findings prompted dramatic changes to cancer treatment in the U.S. The number of deaths due to cancer in the U.S. began to plummet. It triggered the collapse of rights and interests regarding cancer in the U.S. However, the pharmaceutical industry, medical associations, Ministry of Health, Labor and Welfare, and politicians in Japan maintained their silence. Regarding the reason for this, Dr. Kondo of Keio University says, "It's due to the huge amount of rights and interests associated with the cancer industry." Moreover, an incumbent key person of the Ministry of Health, Labor and Welfare stated in a keynote speech at the Health Economics Forum Japan, held in central Tokyo on October 20, 2005, "There's no need to pay insurance for anti-cancer drugs because they are ineffective." An expert technical officer of the same ministry also stated, "Everyone knows as fact that anti-cancer drugs cannot cure cancer." Furthermore, Mr. M., a former employee of the ministry, talked about how anti-cancer drugs have their roots in diluted toxic gas used for genocide by the Nazis of Germany in the Second World War. It was in 1946, immediately after the war, that toxic gas, used as a chemical weapon, was used as an anti-cancer drug for the first time. During the war, an American transport ship carrying nitrogen mustard sank in the port of Bari of Italy after a bomb attack by the German army. This led to 617 U.S. military personnel being exposed to the gas that leaked out, who experienced lowered blood pressure and a rapid decrease in peripheral blood vessels, causing white blood cell counts to plummet. 83 people died within a few days of exposure. Upon receiving this report, the U.S. military realized that the gas could be used to treat malignant lymphoma, and in August 1946, an experiment was carried out in which terminal cancer patients were administered diluted mustard gas for 10 days. This resulted in the malignant lymphoma being completely eliminated after 2 weeks. But a few days later, all the subjects were dead. After that, in 1949, Professor Morizo Ishidate of the Faculty of Medicine at the former Tokyo Imperial University developed a substance known as nitromin from diluted nitrogen mustard, which was sold as an anti-malignant tumor agent by Yoshitomi Pharmaceutical Industries. Furthermore, chlorambucyl methylene and uracil mustard were developed as derivatives of nitrogen mustard, and these chemicals continue to be used to this day in Japan. In other words, anti-cancer drugs are nothing more than toxic gas. Journals have the following to say about the efficacy of nitrogen mustard. Nitrogen mustard is known for its powerful effects on the proteins and DNA that make up the human body, and it is toxic because it denatures them or damages genes. This is why exposure to the toxin damages the skin and mucous membranes and hinders cell division. Moreover, if it damages the genes associated with cancer, it may even trigger cancer. These are exactly the same as the side effects of anti-cancer drugs. Then there is radiation therapy. Regarding the dangers of radiation therapy, Professor Abo, mentioned earlier, says, "The heightened risk of radiation therapy causing cancer is no match for chemotherapy. Moreover, the X-ray examinations and CT scans used to diagnose cancer have the potential to trigger cancer just like radiation therapy." Dr. Kondo, mentioned earlier, who is a radiation expert, points out the level of radiation exposure in a CT scan is not as high as that of radiation therapy, but it's an easy way of heightening the risk of cancer. It's ironical that a medical examination with the aim of early detection and treatment should increase the risk of developing cancer. Shunsuke Funase, a commentator renowned for his book criticizing anti-cancer drugs, published the results of a survey in his book asking doctors in active service, if a member of your family developed cancer, would you let them undergo chemotherapy? According to this survey, 270 out of 271 doctors replied that they would refuse chemotherapy. Is this true? If it is, what are the other options?